Menopause. It is a physiological and natural event in the life of women. It is characterized by permanent cessation of menstruation. Most women anticipate such an event as the age advances. Perimenopause. It is a period of 3 to 4 years before the actual menopause is characterized by a number of changes in the body due to declining levels of the hormones produced by the ovary. These may include mood changes, hot flushes, generalized weakness, alteration in the menstrual pattern. Most women accept these changes and anticipate the onset of actual menopause in the near future. However, for some it may produce anxiety, fear of cancer, etc. The management comprised diet, advice on smoking, alcohol cessation, calcium supplementation and exercises will help. Smoking is toxic to follicles and cause rapid metabolism of estrogen in the liver and hence anti-estrogenic. Counseling on contraception will help. Intrauterine contraceptive devices, oral combined pills are not recommended on account of irregular bleeding and risk of thrombosis respectively. If a woman has fibroids, a shorter course of GnRH or Mirena IUD will shrink the fibroid and avoid hysterectomy. Dysfunctional uterine bleeding requires investigation. The woman needs guidance on menopausal symptoms. The need for hormone replacement therapy will be discussed later. Diagnosis of approaching menopause. Fall in level of inhibin B, not inhibin A, causes a rise in follicle stimulating hormone FSH level. FSH greater than 40 international unit per level is reported. Rise of FSH, LH more than normal values. A fall in anti-Mullerian hormone suggests a low ovarian reserve and low antral follicular count. Study of FSH level on day 2 to 5 after the last menstrual period detects premenopausal stage. Menopause is defined as a cessation of ovarian function resulting in permanent amenorrhea. It takes 12 months of amenorrhea to confirm that menopause has set in, and therefore it is retrospective diagnosis. Climacteric is a phase of waning ovarian activity. May begin 2 to 3 years before menopause and continue for 2 to 5 years after it. The climacteric is thus a phase of adjustment between the active and inactive ovarian function. Occupies several years of woman's life and it involves physical, sexual and psychological adjustments. Demography. 60 million women in India are older than 55 years of age. An average Indian woman now lives up to 65 years. In developed countries up to 8 years is possible. Age. Menopause sets in when the follicular number falls below 1000. Menopause normally occurs between ages of 48 and 52 years, average age being 49 years. It is not uncommon, however, to see a woman menstruate well beyond the age of 50 years. They are related to good nutrition and better health. Menopause setting before the age of 40 years is known as premature menopause. Menopausal age is not related to menarche, race, socioeconomic status, number of pregnancies, and lactation. Pathophysiology. During climacteric, ovarian activity declines. Initially, ovulation fails. No corpus luteum forms and no progesterone is secreted by the ovary. Therefore, the premenopausal menstrual cycles are often anovulatory and irregular. Later, Graafian follicle also fail to develop. Estrogenic activity is reduced and endometrial atrophy leads to amenorrhea. The cessation of ovarian activity and a fall in estrogen and inhibin level causes rebound increase in the secretion of FSH and LH by the anterior pituitary gland. The FSH level may rise as much as 50-fold and LH 3 to 4-fold. Menopausal urine may become an important commercial source of human menopausal gonadotrophin. Hormone levels. There is 50% reduction in androgen production, 66% reduction in estrogen production at menopause. The estrogen level may remain low at 10 to 20 picogram per ml. Some estrogen comes directly from the ovary, but most of it estrone E1 derived from peripheral conversion of androstenedione secreted by the ovary, and its levels varies between 30 and 70 picogram per ml. The ovary secretes a small amount of testosterone which causes mild hirsutism at menopause. FSH appears in high concentration in the urine. E2 by E1 ratio maintained greater than 1 in the premenopausal period is reduced to less than 1 after menopause, causing an estrogen deficiency state. Estrogen level greater than 40 picogram per ml exerts protective bone and cardiotropic effect, but the level less than 20 picogram per ml may predispose to osteoporosis and ischemic heart disease. Level of growth hormone also causes ovarian failure. Risk of menopause related diseases are early menopause, surgical menopause or radiation, chemotherapy, especially alkylating agent, smoking, caffeine, alcohol, family history of menopausal diseases, drugs such as GnRH, heparin, corticosteroid, clomiphene, when given over a prolonged period more than 6 months can lead to estrogen deficiency. Diabetes. Anatomical changes. The genital organs undergo atrophy and regression. The ovaries shrink, their surface becomes grooved and furrowed. Tunica albuginea thickens. The menopausal ovary measures less than 2 into 1.5 into 1 centimeter or 8 ml in the volume. Seen on ultrasound. 15 years later, it should not measure more than 2 ml. The plain muscle in the fallopian tube undergoes atrophy. Cilia disappear from the tubal epithelium and tubal plica are no longer prominent. Uterus becomes smaller because of atrophy of its plain muscle, so that connective tissue are more conspicuous. The hormonal levels are E2 is around 5 to 25 picogram per ml, estrone 20 to 70 picogram per ml more in obese women, FSH greater than 40 milli international unit per ml, androgen 0.3 to 1.0 nanogram per ml, testosterone 0.1 to 0.5 nanogram per ml, LH 50 to 100 milli international unit per ml, androstenedione 800 picogram per ml, growth hormone, inhibin B or anti-Mullerian hormone are low.